I was talking the whole time. Hey, everybody. I know everyone's coming in slowly but surely, but we're going to go ahead and get started because we do have a lot of information that we want to share with you all today. So welcome to part 3 of the Collective Resiliency webinars. This is our third session. We have put on 3. This is our third one. First one was on mental health. The second one was on food nutrition, and our third and final will be on NC Medicaid. Just to introduce the space, we do have multilingual options. Our interpreters can be found on your Zoom toolbar. At the bottom, there is a globe where you can choose which language that you'd like to hear the webinar off of. So English or Spanish is offered. And we also dropped in the chat brief instructions on how to get that set it up. Alrighty. Okay, perfect. And thank you all for joining us. I know we have a couple of people in. So we can start by introducing NC SIL and who we are. So we are in our third year. We are put together by UNC Center for Health Equity and Research and Community Campus Partnerships for Health, as well as the North Carolina Central University Accord. We are funded by the NIH to conduct research, offer inclusive resources, and we are looking to go into our fourth year starting in April. So we're excited to continue to do our work. We started out doing long COVID, but now we're moving into food as a social determinants of health. So thank you all for joining us today. Our guest speakers are from NC Medicaid, the North Carolina Department of Health and Human Services. We have Ms. Monica Johnson, who's the engagement manager for NC Medicaid Communications and Engagement. And we have Ms. Yasmin Rico, who is the Director of Hispanic and Latinx Policy and Strategy for the Office for Health Equity. So we are so grateful to have them here today. And ladies, are you ready?
We are.
All right, good stuff. So we're going to go ahead and get started today, and I'll hand it over to you.
Thank you. Thank you so much, first to the organization for inviting us to share a little bit of information with you all about Medicaid expansion. We look forward to providing a lot of information, but would also appreciate if there are any questions to please put them on the chat, and we will try to get to them as soon as we can throughout the presentation and at the end as well. We are, as it was mentioned, from the North Carolina Department of Health and Human Services, Monica Fuller and myself, and we have, I would say, more specific information on expansion. There might be other questions around Medicaid, and so if there are questions that you have that we are not able to answer today, we will follow up with the NCCO team to provide that information after. So we can go ahead and get started. We can go to the next slide. So as some of you might know, Medicaid expansion was launched on December 1st. And so it's only been a short few months since we started to enroll people on Medicaid through expansion. What expansion really means is that more people in North Carolina can get access to healthcare coverage through Medicaid. Through expansion, we anticipated or expected that more than 600,000 people now will be able to access healthcare coverage. For the Latino community, which is the population that I focus on, more than 50,000 Latinos in the state will benefit out of the over 600,000. As of February 1st, we know that more than 346,000 people in the state have enrolled. And for the Latino community, this is more than 30,000 Latino community members. So we are doing really well in terms of enrollment on expansion. and wanted to sort of start with that information because this presentation is really important as we continue to try to make sure that the word gets out about what expansion means for the state and who may be eligible to be able to benefit from the program. So what expansion is providing is for more people ages 19 to 64 with higher incomes than what it was covered in the past, for them to be able to apply for Medicaid if they also have the other criteria for enrollment. This means that before expansion, before December 1st, people 19 to 64-year-olds did not have this opportunity, and now they do. We really want to make sure that this message gets across because there's people who might have applied in the past and didn't qualify, but now they might actually qualify thanks through expansion. What Medicaid covers, as we know, a lot of us know, is health services, the doctor's visits, checkups, emergency care, and also care for during and after pregnancy, vision and hearing services, prescription drugs, health devices, dental, and other services at little or no cost to the person who is benefiting from Medicaid. There is no monthly fees or copays that are more than $4. So this is a really important opportunity for the people in our community to benefit from this coverage. 600,000 people in North Carolina, that is a large number. We have been doing well, like I mentioned, on enrollment, but getting to that less than 50% of the population will continue to take a lot of work and efforts, specifically support from community-based organizations, community health workers, people on the ground who have a connection in community. So we really hope that from the presentation today, you can take away that more people may be eligible for Medicaid and that there are resources that they can tap into to figure out if they qualified and hopefully applied for this healthcare coverage. We can go on to the next one. So I mentioned some of the benefits of Medicaid in terms of the services that it provides. And you can see some of those on the screen. I do want to encourage people to visit our website, which is medicaid.nc.gov. We have a lot of information there as well. So by no means we hope that you memorize all this information today, but we really want you to know where you can go to continue to tap into the information and resources if you come across community members that need more information. The website that we have in English, once again, medicaid.nc.gov. In Spanish is masmedicaid.nc.gov. And we have information there, including a toolkit with information and resources that can be used. You can download those, you can share links, and we also have a frequently asked question area where there is a lot of good information, and we really crafted those questions based on the feedback that we were getting and the questions that we were getting from the community. So that is another resource that we want you to be able to use. And I know after the presentation today, a list of resources will be sent to you all. And so you will be able to have that information with you. And we can go on to the next one. So this is when we start covering a little bit more information on that eligibility for Medicaid through expansion. So most people will be able to get health coverage through Medicaid if they meet a specific criteria. And so on the chart on the left-hand side, you will see how North Carolina is expanding healthcare coverage to more people. So the people that were eligible for Medicaid before December 1st, they still are eligible, but now more people listed on the based on the criteria on the left can also get coverage. The criteria to be eligible includes to live in North Carolina, once again, to be between the ages of 19 and 64 years old, and to have either a qualified immigration status or to be a citizen of the US. So that is something that we will get to cover on the next slide with a little bit more detail. In this current slide, what you're seeing is the household income. And so your household income before taxes are taken out has to fit within the table on the left for you to qualify, once again, if you're 19 to 64 years old and if you were not eligible before. What really helps to determine if you qualified and based on your income limit, it's the size of your family. And so the size of the family is based on the people that you expect to claim on your taxes, like your spouse and your children. An example of this, if you are a single adult and your income is less than or 20,120 a year, you could be eligible for, or you would be eligible for Medicaid if you also have the other criteria. If you're a family of two, you would need an income of 27,214 or less to qualify for Medicaid. So you can see the list of the incomes on the left hand side of this table. Something that I've heard a colleague of mine that is doing a lot of presentations that it's, I thought it was very important to kind of highlight as well. Sometimes we do the math, like how many hours a week I work, and then how many weeks there are in the year. And we might think, okay, I make slightly over the threshold. And so that might discourage people. But the reality is that there's people who also may be out from work because of an illness, because of a family situation. And so it is really important to not be discouraged. If your income is really close to the threshold here, go ahead and apply because you may be eligible. And, you know, from year to year, even if you have the same salary, things change all the time. And so if you are close to these income ranges, we definitely encourage you to apply. As I mentioned before, you have to have either a qualified immigration status or be a U.S. citizens, or be a U.S. citizen. And there are some exceptions that we will also get to cover on the next slide. Before we move on, I just wanted to highlight that the table on the right shows the annual income limits before taxes for 2023 for children, pregnant women, older adults, over 65, people with blindness, and people with disabilities. So this is the income requirements for people that were eligible before expansion, and that continues to be the case for people who fall into these categories per se. For children, the number of children that are in the household that are part of that family helps to determine the income limit. So those limits are different if a family has 1 or 2 or 3 children, as it's shown on the table. The same thing is for pregnant women. The number of children they have helps to determine the income limit. And for adults 65 years or older, the size of the family as a whole helps to determine the income limits. Most people who do not fall into any of the groups for the table on the right will still qualify for Medicaid if they fall into one of the income groups for the table on the left. I know that this is a lot of information and sometimes people get overwhelmed. So we really wanna encourage you, if you think that you're eligible for Medicaid, to go ahead and apply. You can also reach out to a North Carolina health insurance navigator who can help you to figure out if you are eligible and to help you apply. You can make an appointment with a navigator by visiting ncnavigator.net or by calling 855-733-3711. And this information, once again, will be shared with you in the resources that you will get after this session. So if you still are not, if you still don't qualify for Medicaid, we will also be sharing some information on other options that you may have. And it's important to know that if you do not qualify, your children may still qualify. So this is good information for the community. And we can move on to the next slide. Thank you. And this is where there is a lot of more information as well. And once again, even people like myself that are deeply involved in really elevating the needs of the immigrant community and making sure that we're bringing this information to more people. I do not know all this information by heart. I know a few things and I know where to get more information if needed. So that is something that I want you to know. You don't need to memorize this list. There are resources available so you can pull this information when needed. The important thing to know is that people who are not U.S. citizens but have a qualified immigration status can also get health coverage through Medicaid if they meet the other eligibility criteria as well. And so to be eligible, people must live in North Carolina, have one of the qualified immigration status in this list. And for the most part, many people have to wait at least 5 years before they can apply to Medicaid if they have one of the qualified immigration status in the list. There are some exceptions, and I will touch on those shortly. So what means waiting 5 years, it's from the time that they get that status, they have to wait 5 years before they can get Medicaid. And I do want to highlight that because there's people who might have been in the country for a few years and then they got one of the statuses on the list. It is from the time you got the status. It's not the time that you have been living in North Carolina. And so the list includes lawful permanent residents, asylees, refugees, Cuban Haitians, Haitian entrants, parole into the U.S. for at least 1 year, victims of traffic, and his or her spouse, child, sibling, or parent, or individual with a pending application for a victim of trafficking visa, and the list goes on. What I want to highlight again, this information is available in our website. You can visit medicaid.nc.gov/immigration to get to the frequently asked questions that touch on this topic. You can also visit masmedicaid.nc.gov diagonal inmigración. So we have that information in English and in Spanish, and also in our website, you can select on the feature on the right if you need information in another language. The exceptions that I wanted to refer to, who does not have to wait 5 years if they have a qualified immigration status. This includes refugees, asylees, and lawful permanent residents who used to be refugees or asylees. So for this group of folks, they don't have to wait 5 years. And also pregnant women, pregnant people, and children don't have to wait 5 years. And so those are some exceptions. I know that this is a lot of information, and once again, you can find this in our website. We have a 2-pager with information in our communications in our Medicaid Expansion Toolkit that once again can be found on our website. So it is really important for us to kind of just share the message that not only U.S. citizens can qualify, there's other people as well. And even if this is a little complex, there are information and resources that people can use. The navigators that I mentioned before, they are also knowledgeable about who qualifies. They can help people to figure this out, and they have more than 20 languages as well that they can support people in to be able to walk them through eligibility for Medicaid, depending on their immigration status. And we can go on to the next slide. And so this is tied into the information that we were just providing. There are some people who may not qualify for Medicaid, for full coverage of Medicaid, because they might not be a US citizen or they might not have a qualified immigration status. And I say that there are a lot of other statuses that unfortunately don't qualify for Medicaid. A lot of this information is in the two-pager that you are seeing on the screen. Once again, it's available in English and in Spanish in our website in the toolkit. And we also have shared this resource in printed form with a lot of organizations across the state, and we'll continue to print more materials as needed. The main thing that it's important to elevate is that for people who don't qualify for full Medicaid, they may be eligible for emergency Medicaid, depending if they have an emergency condition that needs to be treated in an emergency room. So this could look like a car accident. It could be like a person or woman in labor and delivery in the hospital. And so there's more information on the frequently asked questions in the website. Once again, medicaid.nc.gov/immigration or massmedicaid.nc.gov/immigration. Some examples of other statuses that are not qualified for Medicaid include the farm worker population, H-2A workers, and also DACA recipients, Deferred Action for Childhood Arrivals. Those are some of the I guess examples that come to mind of immigration statuses that are not that don't qualify for full Medicaid, but may be eligible for emergency Medicaid. And so that information is on this document. And for a lot of the population who may not be eligible for Medicaid, we always want to elevate the importance of making sure that they get connected with a community health center, with a community clinic, with a federally qualified health center. There are many of those resources across the state, and they provide support services and healthcare to people regardless of health insurance or immigration status. And it's a great resource for the community. And so that information, once again, you can find it on this two-pager and on our website. And we can move on to the next slide. So I mentioned this briefly, but under Medicaid, you do not have to pay a monthly premium, and Medicaid pays the cost for most healthcare services. The highest copay is $4, and it's only needed for some services. So this is very important for the community to know. If people think that they may be eligible, it's better for them to apply. You don't lose anything with applying. And you might actually gain coverage. And so my colleague Monica is going to continue with the rest of the presentation. And once again, if you have any questions, please add them to the chat and we'll get to them at the end of the presentation.
Perfect. Thank you, Yasmin. Thank you all for being here. You can go to the next slide. Thank you. So what information do I need to apply? So if you think you qualify for Medicaid, and again, emphasizing what Yasmin said, if you think you may be eligible, we encourage you to apply. It takes time to complete the application, so we recommend that you set aside at least 1 hour to fill it out. You'll be asked some specific information about each person. This includes information like your full name, your date of birth, your social security number, your immigration status, where you live in North Carolina, and your income information. And you can pull this income information from pay stubs or W-2 forms. Next slide. So what documents can be used if DSS asks for more information? If asked for more information, there are a variety of documents that you can use to get the information that they need. To help verify where you live in North Carolina, You can use a photo ID with your North Carolina address listed, a utility bill with the address and your information on it, a lease or mortgage agreement, a vehicle registration, or employment documentation. Next slide. So what if I previously had limited benefits through family plan and Medicaid? People who had limited benefits through family plan and Medicaid before December 1st, 2023, and met the new eligibility rules, they now automatically have full health coverage through Medicaid as of December 1st, 2023. If you were automatically enrolled, you got a letter from your local DSS letting you know you will start getting full Medicaid coverage. You were also assigned a health plan. If you want to change the health plan that you were assigned, you will have 90 days to pick one. Next slide. I'm sorry. Lastly, you should also receive in the mail a packet from your health plan. This packet includes a new Medicaid ID card. Your ID card also has the name of your primary doctor. You can change the doctor you were assigned by contacting your health plan. If you have health coverage through healthcare.gov, you will need to cancel that plan. And you can do that by logging into healthcare.gov or calling their 1-800 number, 1-800-318-2596. But do not cancel your plan until you receive information from your health plan through Medicaid. That is very important. Don't cancel your coverage until you receive the information from your Medicaid coverage. So not everyone with limited family planning program benefits was automatically enrolled in full coverage through Medicaid. Some people may have income that is higher than the Medicaid income levels. If your income has recently changed and you think you may be eligible, please do update your information in ePass, which I will talk about in the next slide, or you can update your information by contacting the local DSS. You can learn more at medicaid.nc.gov, and you can see that we're going to give you that web address a lot of times because we really want you to know that you have access to information there. Or you can contact the North Carolina Medicaid Contact Center at 888-245-0179, or the North Carolina Medicaid Ombudsman at ncmedicaidombudsman.org. Next slide, please. So here are the ways that you can apply for Medicaid. You can use ePass. ePass is a secure self-service website, and you can visit it by going to epass.nc.gov. You can also apply for Medicaid online through healthcare.gov. When you apply online, you can avoid going in person to your local Department of Social Services office. And if you submit a complete application, the state can process it faster. If you can't apply online, you can apply in person at your local DSS office by calling your local DSS or by mailing in a paper application. And you can access a paper application at medicaid.nc.gov/print-application. To find your local DSS office, you can go to ncdhhs.gov/local DSS. Next slide, please. So after you apply for Medicaid, it may take up to 45 days after you apply to be fully covered. If your application is not complete, it may take longer. There are a few ways you can help the process go faster. Apply online at ePass or healthcare.gov and provide all the information that's been requested. Keep your contact information up to date in ePass or healthcare.gov so you don't miss important information about your Medicaid benefits. You can also sign up for an enhanced ePass account. With an enhanced ePass account, It'll allow you to keep information updated without having to contact your local DSS. If your application for Medicaid is not complete, it may take longer to process. Your local DSS will reach out to you if they do not have what they need to complete the application. And they may reach out to you by mail, phone, email, and or text message. So it is very important to make sure your contact information is up to date and complete. That way your Medicaid caseworker can easily reach you. Also, please be careful of scams that target people who may be eligible for Medicaid. Remember that your local DSS will never threaten you with legal action or ask for money or credit card details for you to keep or qualify for Medicaid. And you cannot be pre-qualified for Medicaid. So look out for scammers who say you can. If you are not sure about information or mail you get asking for information from you, contact your local DSS. So if you have that doubt, go straight to your DSS, give them a call. Next slide. So there are a few things to know about Medicaid once you are approved. Most people who get health coverage through Medicaid are part of NC Medicaid Managed Care. This means you can choose the health plan that is best for you. All health plans offer the same base services. Some have extra services. Each has its own network of doctors and professionals. You can choose your health plan and your primary care doctor when you apply. Primary care refers to your family doctor or clinic or healthcare provider. You will get a healthcare plan ID card in the mail. It will come from the health plan that you selected during the application process. If you did not select a health plan, one will be assigned to you. You have 90 days to pick a new one. You will receive a packet from the NC Medicaid enrollment broker that tells you how to change your plans. Your ID card also has the name of your primary care doctor on it. If you did not choose one when you applied, one will be assigned to you. Next slide. And what if you're still not eligible? If you're still not eligible for health coverage through Medicaid, you may still be able to get health coverage offered on healthcare.gov. Open enrollment for 2024 began November 1st, 2023, and ended on January 16th, 2024. You can apply at other times of the year if you qualify for special enrollment, such as a loss of job, a change in a family circumstance, or the loss of Medicaid coverage. Many households that apply may be eligible for help to pay for their premiums. Visit healthcare.gov to learn more. You can also contact a North Carolina health insurance navigator for help enrolling. Visit ncnavigator.net to learn more, or you can call 855-733-3711. If you don't have health insurance, you can also get basic health care services at community clinics that offer services to uninsured and underinsured individuals. Many of these clinics are also known as federally qualified health centers, and they offer services at a lower cost for people without insurance, regardless of their immigration status. You may also be able to find services at rural health clinics and other free and charitable clinics. These centers provide low cost on a sliding scale based on your income and insurance status. Please do take time and visit the link with these slides will be available to you for additional resources for yourself or to share with others. Next slide. Remember, North Carolina has expanded healthcare coverage to more people, and you might be one of them. More than 600,000 people are now able to access healthcare through North Carolina Medicaid. And with Medicaid, many hardworking people can finally afford to take care of their health. We encourage everyone to get covered and stay healthy. Don't forget to visit us at medicaid.nc.gov for more information, or you can give us a call at 888-245-0179. So now I'm going to turn it back over to our Q&A if there's any questions or comments.
Thank you so much, you two. It was really awesome hearing that information. And just as a reminder, we will share out the slides. We'll also share out a one-pager with all of the links provided and some frequently or commonly asked questions that we've received so far. So we do have 2 questions to lead with, but if once we finish these 2, if you all have any more questions, please feel free to come off mute or drop them in the chat and we can read them out. So our first question is, what happened with the person that is waiting for the status that is an asylee or a refugee?
Thank you. That is an important question. I think for the most part, when we get refugees or asylees, okay, let me rephrase this. For the most part, refugees and asylees, when they arrive to our communities, they already have, for the most part, like the paperwork, and oftentimes they're working with a resettlement agency to support them over the first few months. There are other cases, of course, aside from that. I think it's very important to make sure that you apply if you think you may be eligible. They do require the sort of immigration paperwork to turn in. So if you are waiting still and don't have that paperwork, you may not be eligible to, you might not be able to apply. So I think I would rather encourage people to apply if they think they're eligible, and they will be able to figure out in the process if they're eligible or not. There are other statuses that do take longer, that they may be in the process, but they haven't actually received that status. I think the question too was like, what happens while they're waiting? The other health resources that we mentioned, like the federally qualified health centers, are an option. There are also other services available through the local health department and community clinics in the area across the state. And so there are other resources if they don't have the status yet to be able to get coverage. But if they are not sure, I would lean towards applying. I do want to highlight one more thing connected to this topic. On that 2-pager and in the frequently asked questions, we have included information on public charge, which also is known in Spanish as carga pública. A lot of people in the immigrant community have been are still afraid of using some government services because they may think that is going to impact their ability to adjust their status in the future. And the reality is that Medicaid is not considered public charge. People who are eligible should apply and get benefited, and this information is not shared with other agencies for immigration enforcement or anything like that. So it is really important that those who may be eligible apply. We have a lot of mixed status families in the state. Once again, if the children are eligible, they should apply and benefit from this program. If other people in the household are eligible, they should apply, and it won't have an impact on other people in the household as well.
Thank you. And that question was asked by Jessica Aguilar. She's one of our coalition members with NC SEAL. Can you let us know if that answered your question?
Sorry, it's like I changed the
channel.
The channel. Yeah, it's because I have some families they accept and receive the Medicaid, but I have other families that go to the DSS and say no, they can't access yet, and that's why it's the confusion.
And thank you, Jessica, and thank you again. It's good to see you in this space as well. We just got a chance to connect recently. Yeah, I think it is better to lean towards checking. And I think if people are not sure with an answer, like the navigators, the North Carolina Consortium of Navigators is another great resource as well, because they also get to do a lot of applications and are familiar with this. So if someone is unsure based on the information that they were giving, they can always also check with the navigators. I think it really comes down to the case in terms of what paperwork, where you are in the process. And for a lot of these statuses, you have to have that status already. So it's better to check. Sometimes there's confusion because you are in the process, but you haven't actually been approved yet, and they will request that documentation. So thank you for asking that question. And there's one more question around if there are Medicaid community navigators for community events. The North Carolina Consortium of Navigators, they have on their website a list of events. So I'm gonna put the link on the chat again. If you scroll at the bottom of that page, you can see the events that they have in different counties, the date and the time and the location. So they are actively also in community trying to promote this information. I also wanna say that if anyone in this call is interested in a presentation like this, in person or virtual, please let us know, because we continue to share this information with more people across the state. Monica and I have been doing a lot of this information in person, virtual, and also we have a colleague, Francisco Guzman, who's out and about every day in the community bringing these resources. So we want to make sure that we're promoting this information. And once again, there's different ways that people can apply. And Monica touched on those. And so we hope that one of those work for the communities that you're serving. And again, that you know where to go for this information, because I know it's a lot to digest. And so it's also available for you online.
Thank you, thank you. And again, I do want to reiterate, we will share out every link that we've received and that we've shared too also. Does anyone else have any questions?
It's always a good day when there's not more questions.
Right.
I think there might have been someone.
I would just like to say thank you so much for sharing this information with us, and thank you for answering that question about the navigators. I missed that slide, I think, when you first it was first posted. So thank you for repeating that information. I have contacted DSS myself, and there is a long wait line. And for people who are trying to get an appointment, it can be very discouraging. So that's why I was asking if there was someone available in the community. Because when you go to some of the health services like Lincoln Community Health Center or even Duke or something like, they're looking for people who are using their services, or they're trying to get a doctor's appointment that day or to be seen for an appointment, but maybe they want to be proactive and go ahead and sign up for Medicaid before they need the service. And so that's why I was asking to get that information out. So thank you so much.
Thank you. Thank you. And thank you for sharing that, because I do know that depending on the county, the sort of level of workload that people have, and a lot of counties are experiencing, seeing more people, which is good, because that means that there's interest and that more people will get coverage. So we do acknowledge that there might be a waiting time. I think over the phone sometimes happens as well, because people are calling in and and there might be a little bit of that sort of delay in being able to speak with someone. I do want to highlight the consortium is one of those opportunities. There are navigators across the state that are holding these events and that are continuing to look for events. So if you know of events that are happening where people can come and share information, please reach out to the Navigators Consortium for more information. The other thing that I was gonna say, I think in general, you know, supporting in person is always helpful. And there's more information that we can share later. There's gonna be an ambassador program through the Medicaid division that more details will come. And I also wanted to highlight there are some organizations, including some federally qualified health centers that are included in their screening, sort of like a way to assess if the person may be eligible, and are helping people to direct them to the social worker or the person on staff who can help them and guide them and encourage them to apply for Medicaid. I was in conversation earlier with Piedmont Health Services, which is a federally qualified health center, and they're implementing that in other organizations across the state as well. So those resources are out there. I think it's just a matter of connecting the dots and making sure that if one way of applying doesn't work for someone, that we look for like the other options. The ePass is one way. Healthcare.gov, the marketplace, also can now, people can now do applications through healthcare.gov. So that's another option as well. But I know that oftentimes in person and over the phone, it's much better. So I'm going to stop right there. I know that we're getting close to time and there are other announcements too.
Yeah, please don't stop. Anything else that you have to share? It looks like we have a question.
I would just like to add that on healthcare.gov, they also have a place that you can go that says find local help. And, you know, they can put their zip code in and it does pull up all the assisters that are in that area. I would just say, you know, just be mindful because some of those are brokers. And so you may want to just gear them more towards the assisters than the brokers. So that can be another way to find. And the North Carolina Navigator Consortium is really good resource as well.
Thank you. Thank you for adding.
Yes, thank you for adding that. Also, I wanted to check back to make sure that we don't have any other questions for our guest speakers. I know that we are approaching 6 o'clock and I want to be mindful of everyone's time. Sorry, I thought I heard somebody come off mute. Okay, well, we definitely appreciate everyone for joining us this evening. I know that it's been a long day and it's the end of the week, so we are grateful that you all joined in. We're willing to soak in all of the information. We will be sharing out the presentation slides as well as a one-pager with the links that were shared within it. And thank you for joining our Collective Resiliency webinars. Well, with the email, with the resources, we'll also have a survey for you to complete for our guest speakers. Here is theirs if you want to capture the QR code really quickly, but we've also dropped it in the chat. Miss Monica did. And yeah, to stay up with us, follow us on social media. Subscribe to our newsletter also, where we always have mega resources in there for you. And also if you have any events, please share them with us.